Culture and Nutrition in the Southern United States, Alexandra Hardy, American University. Begin with food and culture. Food habits dictate the who, what, when, where, and why behind food choices and are a representation of the culture and history they've evolved from. They can identify beliefs, practices, and demographics, as well as facilitate social interactions. Nutrition, educators, and culture. Cultural competence is an awareness and an acceptance of cultures and the ability to interact effectively with people of diverse cultures, while cultural relativism is the idea that a person's belief, values, and practices should be understood in the context of that person's own culture rather than that of another. These are challenges healthcare providers must address when aiding clients. I chose to apply these terms to studying the food, history, and culture of the Southern United States. The Southern cuisine is an amalgamation of Native American, European colonists, and African slave culinary customs. The African slaves engaged in the production, harvesting, and preparation of food for the slaveholders, but used their own household duties to preserve African values and cultures. The food they consumed and created became a source of wealth. This wealth affirmed the personhood and identity of the slaves in an environment that regulated them to the status of property. After the Civil War, the poverty of what used to be the wealthy white society forced them to consume whatever foods were available. This began the association of Southern fare with white society. After the 1890s, consumer culture and new food products began to be marketed to white middle-class housewives and exploited the popularity of the region's authentic culture. During the Civil Rights Movement, traditional African American cookbooks were popularized. This drew the attention to the politicization of food in the American South. Food workers and 4 students at North Carolina Lunch Counter transformed the African American foodscape and brought it out of isolation. But by the mid-70s, African Americans began incorporating healthier foods such as tofu and tahini into their diets as forms of gastronomic protest against the traditional diet and its perceived limitations to health and well-being. This ended in 1977 with the popularization and publication of Alex Haley's Roots. This changed the way the African Americans thought of themselves and Africa, reconnecting them with the West African culture. The evolution of Southern cuisine developed to encompass not only the traditional foods, but also West African and Caribbean flavors, as well as tofu and tahini. The Southern cuisine is often known as comfort food and is characterized by added fats, fried foods, processed meats, and sweetened sugar beverages. A diet high in these increases the risk of chronic disease, which studies say is highest in the southern region of the United States. A study of the stroke belt found those consuming a Southern diet are most likely to be Southern Black males without a high school education that live below the poverty line. A study of the Mid-South determined an association between lower income and education and higher rates of chronic disease and unhealthy behaviors. Finally, as nutrition educators, we can help facilitate change in the health risks of our clients by initiating nutrition and lifestyle interventions and education. However, it is important when doing this to cultivate an understanding of the client's specific cultural background and its correlation with their food habits before creating a program. In reference to this specific population of the Southern United States, this could be done by offering ways to make meaningful swaps that do not take away from the rich history and culture associated with Southern cuisine.